And there is this again a raging debate in the Western world that some Ayurveda doctors come with generations together of their experience. And their father, their grandparents were Ayurveda doctors, and father was there. Now he is there. Ayurveda experience, and there are some people like I myself who do not have like an Ayurveda background. I mean, they use this as a kind of a marketing tactic that my spiritual guru has taught this particular Ayurveda technique to me, so it is unique to me only, and it is like nowhere seen. So whereas on the other side, we are there academically trained with 5.5 years of BAMS and then 3 years of MD and so on and so forth. The market is open for both, and how to see this, sir?
See, first of all, previously in India, the education of Ayurveda was not so regularized. So then came the CCIM. Then now it is replaced by National Commission for Indian System of Medicine, National Council for Indian System of Medicine. Entire activity now totally under the control of these things, these councils, and they'll prescribe the minimum standard regulations, what should be there and what should be, how it should be trained, or all those things. So if nowadays, if your degree is to be taken, then we need to go for that. That is a valid degree. And when we are trained in a particular college and taught in a college and these things academically, that is the one which is accepted by the legal fraternity. Followed by a spiritual guru, and I was told by him, and I am a traditional Vaidya. That concept is almost outdating. Those who are present, that will be their last generation doing it. Once they are gone, there will be no further things. You cannot have a new person now and coming and saying that I am a traditional Vaidya. No, it cannot be. That is when regulatory ban is there provided. So one cannot become a Vaidya in that nature. He has to come through the professional, official way of training and teaching, and through that only he has to get developed into the come to the mainstream of Ayurveda or whatever medical science or whatever it is. So any regulation, I mean, doctor courses in India or maybe throughout the world now it is regularized. So there is no question of something which is traditionally some person is practicing. Maybe he is practicing since so many days. That will be end for him. And once he is gone out of this world, then there is nobody to keep his tradition in such way. But only his techniques and his information, his knowledge, if he is able to give it to the next generation, that can be carried on. So that doesn't mean that that should not be taken care of. That can be taken care of. But the difference between because my spiritual guru has trained me in such a way that I have a spiritual power, and I don't believe in those things. Skills are developed by the individual. A guru can only train and teach and things, but it can be mastered by the individual, he himself. So he has to train himself, or he has to train in such a way that he imbibes those skills of understanding a condition. Then comes the real result out of it. Of course, to achieve a result, not only simply a doctor or a Vaidya can bring a result. All the four factors, four pillars of Chikitsa Pada, all should be in a very real sense. Doctor, patient, nurse, as well as the drug. All should have possess the required qualities, and they all should come in line, and then only results will be. You may be a very good doctor, you may be a very good person who identify the disease, maybe have a very good setup of paraphernalia, you may have a prescribed a very good drug for the condition. If patient doesn't take it, then result will not be there. So it is supposed to be taken by care by all of them. If all the four pillars come together and fall in line, then only we can have a result. So totally, it is absurd saying that my spiritual guru has taught me, that's why I am superior, and somebody who has trained in a college and is inferior. No, it is not like that. Anybody who has imbibed the skills and knows the knowledge, definitely is good.